Hello everyone, welcome to my channel The Medical World. This is Kanika Arora and today is our new topic is about the abnormal pregnancy, that is obstruction placenta. I will tell you each and every detail of this topic, and I hope you will like this video and find it informative in your medical school. So let's start the topic. First of all is the definition. The obstruction placenta, also called the obstructo placentae, it is the premature separation of the placenta that occurs late in the pregnancy. Discuss about the causes. The first cause is the high parity. That is the woman who has given the birth multiple times predisposes herself to the obstructo placenta. Second cause is the short umbilical cord. If the cord is short, it may cause the separation of the placenta even if small type of injury or trauma occurs. Third one is the advanced maternal age. The women who give the birth or have the pregnancy after the 35 years of age has the higher risk of acquiring the obstructive placenta. Fourth one is the direct trauma. A trauma to the abdomen may cause the separation of the placenta very easily. And last one is the chloroamniotic. It is the infection of the fetal membranes and fluid that may predispose the woman to premature placental separation. Next one are the types. So here are four types of. First one is the grade 0. In grade 0, there is no indication of separation of placenta and diagnosis of slight separation is made after birth. Grade 1 is there is minimal separation which may cause a vaginal bleeding, but there will be no changes in the fetal vital signs. In the grade 3 of the obstruction placenta, there will be moderate separation and the fetal distress will also evident. The uterus will be hard and painful when palpated. And in grade 3, there will be extreme separation of the placenta. There will be maternal shock and the fetal death is imminent if no interventions are done. Now, are the signs and symptoms of the obstruction placenta? It can be monitored and detected early before it progresses to the critical stage. So it's very important to monitor and detect it as early as possible. So first sign and symptom is the sharp and stabbing pain. A woman may experience the pain on the upper uterine fundus as the initial separation occurs. Second one is the heavy bleeding. It usually occurs after the separation of placenta. External bleeding will only occur if the placenta separates first from the edges. The external bleeding will occur as well as the internal bleeding will occur if the placenta separates from the center and blood would pool under it. Usually the external bleeding occurs very rare, but the internal bleeding is very common, right? And next one is the uterus is tense and rigid, most often called the Corabius uterus. It appears as a board-like hard uterus without any type of bleeding. Next one are the diagnostic tests. The diagnostic test and procedures would be enforced by the physicians to finally diagnose the presence of the obstruction placenta. So what we have to do, we have to the hemoglobin level and fibrogen level should be checked. These tests should be performed to rule out the disseminated intercellular coagulation. Next one is the medical management. To avoid any type of worsening condition, the medical procedures are implemented both for the mother and the fetus. So first medical management or the medical intervention will be the intravenous therapy, that is the IV therapy. Once the woman starts to bleed, the physician may order a large Gregg catheter to replace the fluid loss. In this condition, there will be so much bleeding, so IV therapy is started immediately. Second one is the oxygen inhalation. It is delivered by a face mask and which will prevent the fetal anorexia. That is, the fetal cannot suffer from the lack of oxygen, so oxygen inhalation is given to the mother. Third one is the fibrogen determination. This test would be taken several times before the birth to detect the DIC. Next one is the surgical management. Once the condition has reached a state that mildly endangered the life of both the mother and the child, then surgical management is put into the action. First intervention with that comes in the surgical management is the cesarean delivery. Well, if the birth is imminent, it is the fastest way and safest way to deliver the baby via the C-section or the cesarean section. Well, you can say if both the mother condition and baby condition is threatening, so immediately as the fastest way the baby is delivered via C-section. Second is the hysterectomy. The worst outcome would be for the mother to develop the DIC, and to prevent the extensions, hysterectomy must be performed. Thank you for watching this video. I hope you like this video and find it informative. If you like this video, please like this video. Please click on the like button and comment in the comment section how you find this video informative and how it helped you to study in your medical school. And thanks for watching and subscribe to my channel.